Hi, how are you doing? My name is Sebastian Osler. I'm a student physical therapist with Bowling Green State University. Today we're going to be talking about a torticollis patient named Jeremiah, who is a 2-month-old. Today I'm going to be using this stuffed rabbit to simulate what I would be doing with the activities with Jeremiah, or how I would be educating his parents through these activities. So first thing is that Jeremiah has right torticollis, which means that he is side bending to the right side and rotating his head to the left. That's a key indicator of right torticollis. So meaning that he most likely has a tight sternocleidomastoid, possibly some tight upper traps as well. So the first thing that I'm going to do is teach you how to hold him. So the first thing that I would have you do is come right up through the legs, having 2 fingers on his shoulder to stabilize that shoulder while holding him, wrapping your arm around him. The bunny's kind of small, but you would wrap your arm around him up to his chest, and then you would raise the right shoulder up, providing a nice stretch to that sternocleidomastoid, giving him that side bending motion. So you're just holding him like this and just coming up, holding him like such. So that should provide a nice little stretch right there. The next one that we're going to do is provide a stretch for rotation. So he's rotating to the left side, so we're going to want him to rotate to the right side. So one way that we could do this is by giving him a nice big hug. So by doing that, we're going to be placing our hand on his back, hand on the back of the head. You're not necessarily twisting the head, but just pressing him up against your chest, providing a nice stretch on that right side. All right, and then so the other part of this video is just educating the parents on some ways that they can position him, or some things that they can do to kind of help assist with this process. One of the things is his positioning in bed. So having him lay flat on his back is obviously the best way for them to sleep, but having them positioned so that the door is towards the right to kind of help enhance that right side looking as well could also help with this motion. Another thing, he's very young, so having him positioned on his stomach in order to have tummy time, in order to help strengthen up those neck extensors and elongate those neck flexors. Also for feeding, not having him positioned the same exact way for feeding, kind of switching up the sides so he's not biased to one side. That's all I have. If you have any questions, please let me know.